That is the first term, antibiotics. So antibiotics are the products which are produced by microorganisms, produced by one type of microorganisms that will kill some other microbes. So substances which will be produced by one set of microorganisms, mostly fungus, that will kill other microbes. They are called antibiotics. So they are coming, or they are formed by some microorganisms. The first discovery was made by Sir Alexander Fleming in form of penicillin. Okay, so Alexander Fleming was doing experimentation. He was growing bacteria in agar plates. On one of the agar plate was contaminated by a fungus, a mold called penicillium. Okay, so one of his agar plate was contaminated by penicillium mold. Okay, penicillium fungus. So he grew the bacterial streak in that. Next day when he came, after overnight incubation, he found that the area that was contaminated by penicillium mold did not have any bacterial growth. So he gave the concept that there is something in penicillium that has prevented the growth of bacteria, and that's something he called as penicillin. So Alexander Fleming is credited with the discovery of penicillin, and that's how the concept of antibiotics was developed. Now today there are several classes of antibiotics which are commercially available. Now we can classify antibiotics on various bases. We can classify whether the antibiotic is broad spectrum or narrow spectrum. We can classify if the antibiotic is bacteriostatic or bactericidal. We can classify antibiotics on the basis of their mechanism of action. So there are several classifications which are available. We'll try to combine all these classifications. So let us see what is the best way to classify and remember antibiotics. Divided dose, 25 milligram every 6 hourly. Now how will the graph look like? You see, we have given 25 milligram in one shot. So the concentration will increase, it will start to rise, but now the Cmax will be less than the previous because we have given only 25 milligram at once. So suppose this is the Cmax now. After some time, the concentration would begin to fall, but then you are repeating the dose every 6 hourly, 4 times a day. So you will repeat the dose, concentration will again rise, then again it will fall, then again you will give the drug, then again rise and fall, and finally it will also fall. So here in divided dose, as you can see, the peak concentration or Cmax is low than the single daily dose. So these are the three types. The third one being complex. Different book give different references, but this is the most standard, most authentic from the best books of pharmacology, that is Goodman and Gilman, and best books of medicine, that is Harrison, and various internet resources. You, if you remember this, will be able to solve all questions.